Hello everyone, welcome to our Women's Imaging Live Tour here at Memorial Hospital Miramar. My name is Connie Zarrillo. I'm one of the imaging managers here at the hospital. We're going to take you through a tour of our Women's Imaging Center and also give you a little glimpse of what the experience is like if you come in for your mammogram this year, going through all the steps to get to your final destination. We're going to start right here in our beautiful courtyard. We offer complimentary valet parking Monday through Friday from 7 a.m. until 5 p.m. in the evening. Now we're going to head in. If you were coming in on your scheduled day for your routine mammogram or any other women's imaging exam, you would come in through the main entrance of the hospital. If you come by yourself, you would just go straight into the outpatient registration area. If you're here with a friend or family member, which would be even better, so that you can be better together, they would stop here and go through security as well. If you're all coming in by yourself, we're going to come right over here to the registration desk, where we have Ariel, who is going to tell us about this process of the journey into having your mammogram. Good afternoon, Ariel. How are you?
Good about yourself.
Very good, thank you.
Hi everyone, welcome to Memorial Hospital Miramar. Over here is our hospitality reception where we will be checking your ID and prescription just to make sure everything is accurate. Once that's all set, we will direct you over to one of our offices where one of our representatives will confirm all your demographic information and make sure everything is up to date. And once that's all set, you'll be directed over to the Women's Center, which is where the treatment will be performed.
Thank you, Ariel. So once we're done with the registration process, the next part would be you'll be escorted or directed into the direction of the imaging waiting area. We'll be heading through here. Please excuse the noise. October is a very busy month of the year for us. So here in the women's imaging, in the radiology waiting area is where all of our patients would go primarily first, and then you will be greeted by one of our team members. Here we have Miss Annabelle, and she'll explain this next process.
Hi, I'm Annabelle. Hi, everyone. At this point, we just give you paperwork to fill out. The paperwork is simply required by the radiologist so that it ensures that the results are accurate. And after you're all done with the paperwork, we'll just go from there.
Thank you, Annabelle. Okay, so now we're coming into our women's imaging department. We take much pride into decorating our hallway for our special month of the year. We all put a little bit of time into decorating this area. So now we're going to enter one of the mammogram rooms, and I'm going to have one of the technologists explain. Oh.
Hi.
This is Osmari. She's going to tell you a little bit about this room, and we have Linda here too.
Hi, my name is Osmari. I'm one of the mammotechs here at Memorial. This is one of the three rooms that we have. All of them are 3D machines. This is the machine. It kind of looks similar to the regular 2D. The only difference is that when we take the images, the tube moves to the side and scanning the breast in slices, and that gives the doctor a better detail of how your breast looks in the inside. And let me show you how that looks in the monitor of the doctor. This way. So this is the image, and then if we can scroll, sometimes they can see something, and if it's nothing, they can tell right away instead of doing more pictures. And it has been proven that the 3D has reduced the false call by 40% more. Sometimes if the doctor sees calcification, mass, or asymmetry, we will do more images, and if it looks suspicious to the doctor, maybe they recommend a biopsy. And if you need a biopsy because the doctor thinks there's something suspicious, we'll do it in the same room. This room also, we take all of this off and it turns into the biopsy room. Before we have the prone table where the patient gets to lay down on their belly and put a breast into a hole. Now it's different and it's better, more comfortable. They get to sit in this chair. And we'll move the chair over here. I compress the breast and position until I find the area. The patient turns their head to the opposite side. Me and the doctor will be working on the side of the exam, and then you'll be talking to the nurse all the time. And I have my nurse over here. She'll go over more. If you need a biopsy, she'll explain.
Hello, my name is Linda Bruns and I'm a nurse at Memorial Miramar in the Breast Imaging Department of Radiology. I have been a nurse for 24 years, and of the 24 years I've been a nurse, I've had the privilege of being a breast nurse for 10 years. So only and only if a radiologist has deemed it necessary that a patient shouldn't have to have a breast procedure or biopsy is when I would take care of the patient. In the Memorial system, always our goals are to have our patients feel safe and comfortable at all times. So as a nurse, I would screen the patient to make sure that the patient is safe to have her procedure. Part of the screening process is that we would confirm the patient's allergies to medications. We would go over the patient's history, the surgical and medical history. We would make sure, again, that the patient is safe to have the procedure, and if there were any type of contraindications, of course, we would adjust for our patient's needs. So in the Memorial system, we do, again, have many safety nets, policies and procedures in line to keep our patients safe. So one system that we use is called Crew Resource Management. That is a system where we all check, the doctors, nurse, and techs together. We check that the patient, everything is accurate about the patient. We double check all of our prescriptions. We make sure that they match our patient's pictures for imaging. We make sure that we're always working on the correct side. So for example, if a patient would need a right breast biopsy, the doctor would mark independently their initials on the patient's right shoulder, and I as the nurse would mark a yes, because that keeps us on the safe and accurate side. So prior to anything ever happening to a patient, our patients are taught what will happen before the biopsy should happen, during, and after. Before a biopsy happens, we teach our patients they should not be on any blood thinners 7 days prior to a procedure. And we, before our procedures for breast biopsies or breast procedures, our patients can eat breakfast before they come in. They may drive to and from our procedure, and once they get here, of course, we teach them everything about the procedure. We take their vital signs to make sure that they're safe prior. So for this type of biopsy, for a stereotactic mammogram guided biopsy, as Osmary has said, our patient would be sitting very comfortably in this chair, and then Osmary would place the patient's breast in compression and see the area of concern that the radiologist would want to work on. So, of course, we would clean our patient's skin to fight infection prior to anything happening. Our doctors use a lot of local anesthetics, lidocaine, sensorcaine, to numb up the breast so the patient is very comfortable. And the doctor would make sure the breast is numb before anything would happen. Our doctors use just a very tiny, small device to take the tissue sample out that they would place in the breast. The tissue sampling part of the biopsy takes probably 30 seconds only to get the samples out. After our doctor obtains the sample, they just put in a tiny clip metal marker to demarcate the area of where the biopsy tissue sample came from. And to show you how small all the needle work is, our device, there's no stitches ever involved or cutting. There's just bandages that go on afterwards. So another process in the Memorial system that is very thorough and safe is our specimen collection safe handling of our specimens. So we are very strict here that our doctor, nurse, and tech all together has seen the specimen in the formalin jar with the correct patient's name prior to anything going to pathology. So it's another way to make sure our patients remain safe and comfortable. After the biopsy is over, the patient always gets written instructions for back home. Those would include, of course, contact phone numbers, who to call for any questions. We provide, bandages, ice packs. The ice packs are given to our patients, and they're instructed to use those to decrease any chances of inflammation, pain, bleeding, so on and so forth. And then also we instruct our patients to wear tight bras to support their breast. So we do also, of course, take care of male patients, and we would provide binders for them. And another thing that's phenomenal about the Memorial system is that we have a translation hotline. So any patient that I ever encounter, in fact, less than a month ago, we had a patient that speaks Arabic. So we're able to communicate with our patients and make sure, again, that they feel very safe and comfortable always for a breast procedure. So in this room, that kind of wraps up what we do for breast-related procedures.
Excuse me, I do have a question from Jessica Rodriguez. Thank you, Jessica, for your question. She's asking us, Mari, hey ladies, when do I get my results after my exams? Do I need a prescription?
Yes, you do need a prescription. We also provide, for patients that doesn't have insurance, we provide a nurse and they can do a breast exam and they're going to give you a prescription. For that, you do need a prescription for your exam. For screening mammogram, you get the results within 48 to 72 hours. It gets sent to your doctor. We send you a letter home too. It takes about 5 business days. You can also see the results on my chart. It's an online account that you can check your results. And diagnostic mammogram, they get the results in the same day before they leave home. The doctor sees everything, take a look at everything. If you need more pictures, we get it done right away. And you'll get the results before you go home, so you can go happy.
And also for to answer questions about results, for a tissue sampling breast biopsy, typically the results will come back in 5 to 7 days, and our radiologist will call the patient to tell them the results, or they're providing a physician who has ordered this type of test to happen would contact the patient and give the results. If that's a surgeon, then the surgeon might, so on and so forth. But the radiologist or ordering physician, or both, will definitely contact the patient as soon as possible with results.
Thank you, ladies. And also, just so everyone's aware, Carla's monitoring any questions, so please, if you have any more questions, continue to write them underneath the comments, and then Carla's walking through with us, and we will answer any questions that we can, and if we are unable to, we'll get them to you. Thank you, ladies, very much. Besides having a beautiful building and amazing equipment, we have the most wonderful staff. I'm beyond blessed to have the most outrageous, most knowledgeable mammographers, ultrasound techs, nurses, the clerical staff, everyone, our radiologists are top-notch. So here, for the whole month of October, we also have our whole Better Together photo booth. So we encourage our patients to stop here, use our little props, take selfies, post them on social media, and use the hashtag Better Together, so that we can let everyone else know and encourage them to come out and get their mammograms as well. And these are all of the girls here that put this together for us. So now we're going to go over to another modality that we use for screening breast,
Connie,
for breast cancer. Yes.
sorry to interrupt. We have one more question
Sure.
from Jessica. She's asking about how long would I be waiting during the whole process?
Okay, well, typically a routine screening mammogram, you would come in through the registration process, changing, having the exam done, and leaving. Give yourself about an hour. Sometimes it'll be less, and it might be a little bit more, but because you are coming in through a hospital, it takes a little bit longer. That's for a routine screening because you're not waiting for your results. If you come for a diagnostic mammogram with a breast ultrasound, you're expected to be here typically 2 to 3 hours. That's because an ultrasound typically takes a little longer than a mammogram, depending on the breast tissue and the type of breast that you have. And then at the end, the radiologist will interpret everything before you leave. So that takes time because it's not just the mammogram that was done today, but every other mammogram that you've had in the past is being compared to make sure that there hasn't been any changes from any prior mammograms to the one that was taken today. And that takes time, and we don't ever want to rush through that. So to get the best and most accurate diagnosis and results, it takes a little bit of time. So the 2 to 3 hours is the generals.
Thank you.
You're welcome. Right this way. So now we're going to go into the ultrasound room. We have Mrs. Otay Mendoza, who is going to give us a little bit of information on breast ultrasound.
Hello, hi, my name is Otane and I work here at the Memorial Miramar Women's Center. I would like to speak to you a little bit about breast sonography. I've been a sonographer for 16 years now. We do use ultrasound in this field often. Some of the reasons could be family history, patients with a strong family history of breast cancer. The radiologist could recommend a breast ultrasound. Patients that complain about pain or a palpable mass in their breast, that could be another reason why a patient needs an ultrasound. The ultrasound is done, it's very simple. The patient lays down, we use this probe, it's called an ultrasound probe, and we use gel. We try not to press very hard on the patient. Sometimes it's a little bit challenging depending on the size of the breast, but we manage to do so. The exam can take anywhere from 15 minutes to like half an hour. We apply the gel and we try and locate anything that the doctor might see on a mammogram. It could be a nodule, it could be a cystic nodule, it could be a solid nodule, but we try to do our best to find that. In this room, we also do what we call an ultrasound-guided biopsy. We do cyst aspirations as well. The procedure is very simple. It's very similar to the stereotactic biopsy that Linda spoke about. We prepare the breast the same way. We apply, the doctor applies or injects actually lidocaine to the area and make sure that the patient is comfortable and doesn't have a lot of pain during the procedure. The procedure tends to be very comfortable and the patient tolerates it well. If you have any questions, feel free to text us or let us know.
We do have one
We have a
question.
question.
Sorry to interrupt again.
Oh,
We have a question from somebody who's watching asking if they can do a biopsy if they have breast implants.
Yes, 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 yes. Yes, we, breast implants are very common, by the way. And we do it just like if you didn't have a breast implant. We are very careful to make sure that we do not rupture implants. I've been doing this for a long time, like I said. I still haven't seen one implant ruptured with my experience. It is done the same way.
So also to speak more about breast implants, so our technologists they're experts at what they do. So in the mammogram room, when they're having a breast biopsy, the implant will be pushed out of the way. They put on their compression and they see the breast tissue like that. Obviously, Otane has been explaining the ultrasound biopsy, and Otane, the expert, is holding her probe on the breast so our doctors can see the implant wall very clearly and see the breast tissue around the implant. Therefore, the doctor would never go near the implant wall. Also, we have another safety mechanism that we're always using. So when our patients have a biopsy, after the biopsy is over, our patients do need to have a mammogram at the end to see the clip metal marker. And when the patient has implants, then that mammogram will include the series that will prove that the implant has not been ruptured or the integrity of the wall of the implant is completely safe. So we're always double checking, rechecking for safety. In the 10 years I've been able to do breast biopsies with patients, we've never even had to tell a patient that we can't complete their biopsy because of the implant being there. But if there would ever be a situation where the doctor thought they were too close to the implant, then they would have alternate routes as just follow-ups or surgical biopsies. But again, that's never happened, and we keep our patients safe and healthy and happy. So that's the answer to the question about the implants. Thank you.
Thank you, ladies. Okay, so now what we're going to do is we're going to tour through another area that typically we don't associate very often with women's imaging or women's care, but bone density. Bone density is a very important modality test that women should have. I think it's every 2 years once they're postmenopausal, but it is not very promoted. It's not really out there as how breast cancer is, that everyone's always talking about it. So we have Joan, who is our bone density expert, here to tell you a little bit about bone density.
Hi, my name is Joan and I do bone densities and mammograms. With the bone densities, a lot of my patients, they have no idea what it entails. They come and I ask them, do you know why you're here? They have no idea. Well, with the bone density machine, one of the screenings that we do is for osteoporosis. Osteoporosis is when the body loses too much bone or it produces too little. And that will result in fractures, which in some cases you might result from a fall, but it can also be from sneezing or from a very minor bump. So we have our patients come in, they complete a simple little questionnaire, we take them in, we get their heights and weights, and then I put them here on this lovely table. Most of the fractures might occur in the hip or the spine or the wrist, but it can also occur in other places as well. Some of the consequences of not having healthy, strong bones can be permanent pain. There can also be height loss, a hunched posture. It can lead to a lack of mobility, which also can lead to isolation and as a result, depression. Like I said, it's one of the easier tests that you're ever going to do. Most of my patients, when they come, within seconds of their head hitting the pillow, they're asleep. Because all they're going to do is lie on the table and I scan them. We not only do menopausal women, which because women, when they go through menopause, they start to lose bone mass because they don't have the healthy hormones or the hormones to keep their bones healthy. So, but we also do pediatric cases. There are some children who are on certain medications and they need a bone density scan, and we also do men. Apart from that, there are other tests that we can do with the table. We can give a 10-year probability. We call it the FRAX, the 10-year likelihood of a postmenopausal woman getting a fracture. Some patients who've been on some medication to strengthen their bones end up getting a typical femoral fracture. And with this, we can check, and prior or just the initial stages of that, we're able to detect it so intervention can be done. What else? There are some medications that contribute to it, some steroids, some cancer treatment. What else? Excess thyroid hormones. There are some conditions like cancer, lupus, cancers, I did say that, leukemia, and others, a whole long list. But these are just some of the reasons why it's necessary for a woman to come in, for anyone to come in and have a bone density test. Okay.
Wonderful. Thank you, Joan. Even I learned something today. Okay, so now we're coming to the end of our tour. I just wanted to give you some information about our Better Together specials for October. For the entire month of October, the routine screening mammograms are $50. That includes the 3D, and that also includes the interpretation from the radiologist. For diagnostic mammograms are at $100. Again, that includes the 3D and the radiologist reading. And breast ultrasounds are $99. Again, that also includes the reading for the radiologist. The telephone number to call and schedule that appointment right away is 954-276-5595. 954-276-5595. So please schedule your appointments soon because they are flying off the wall. So, we thank you very much for touring our women's imaging department. We hope to see you soon. We welcome you to our department so that our family can help keep your family safe, sound, and better together.
Better together!